When someone experiences a life-threatening event, their memories of the event become saturated with fear. These memories can often become somewhat stuck in the victim's mind, and this can cause a lifetime of psychological torture. Constant alertness, nightmares, flashbacks, crippling anxiety, and depression. What I've just described is a condition by the name of post-traumatic stress disorder. It's a mental illness that is most commonly associated with military veterans and victims of rape and torture. A mental illness that is present in about 7% of Australian and American adults. Now, this totals about 10 million people in these two regions alone. Also, a mental illness that is responsible for just under a quarter of worldwide suicides. Current treatment options for PTSD involve anti-anxieties and antidepressants that are designed to control a patient's symptoms rather than deal with the trauma itself. Traditional therapeutic measures are largely ineffective because attempting to reflect on these traumatic memories only triggers that associated fear response, and that impedes any kind of psychological breakthrough necessary to allow true healing. But it isn't all so dark, and the answer could lie somewhere that a lot of people don't want to look, and that is in a little place called MDMA, methylene dioxymethamphetamine. It's a synthetic drug most commonly mistaken for the party drug ecstasy, which often contains little to no MDMA whatsoever, and often contains a cocktail of undesirable substances such as speed and methamphetamine. So basically these two substances just can't be evaluated in the same light. Pure MDMA, however, can be used in conjunction with psychotherapy, and this is what is called MDMA-assisted psychotherapy. So this would occur in qualified clinics with specialized therapists. It involves a dose of pure MDMA and then 4 to 6 hours of straight therapy. So how does it work? Well, MDMA increases a bunch of neurotransmitters in the brain, which have a lot of different effects, but most importantly, they improve the motivation and the focus to sit through such a long therapy session. They improve openness and trust with the therapist. And they enhance mood and memory, so these patients are willing and able to access those traumatic memories I spoke about earlier, however this time in a state of mind uncrippled by fear, because MDMA suppresses the fight or flight response. So when you look at all of these effects, it's almost as if someone designed MDMA specifically for PTSD patients. In its earliest clinical trials, about 20% of the group that only had the long therapy sessions without any psychoactive drug were no longer qualified for PTSD at the end of the trial, which actually isn't such a bad number at all. But it is in comparison to the MDMA group. 56% of them cured of their chronic PTSD after 3 exposures to this drug. Most importantly, that number rose on its own to just under 70% on the year later follow-up. Now, these patients, they didn't take MDMA again, but they kept getting better after being exposed to it. Something inside them started healing. Phase 3 clinical trials currently occurring in multiple sites in the US and Canada, and if they show similar successful results, we're likely to see this become a reality by the year 2021. I'd just like to finish by saying that after decades of research on PTSD and MDMA, there has been not one serious adverse reaction to the drug. Side effects that patients did experience are along the lines of a slightly elevated heart rate and a little bit of sweating, which honestly most of us would get if we walked a lap around an oval. So I'd just like to end by saying I hope we can overcome these outdated views that any drug that's illegal is nothing but threatening. I think what really is threatening is withholding access to something that can cure some of the most broken people in our society.